it up.
We're rolling on a Monday. Talk a little bit about this health insurance. Cheap Not Broke fam, how's everybody doing? Welcome back to the show. It's Monday. Is this the first Monday of the month? Is it? I think so. Yeah. It is the first Monday of the month. First Monday of the year. And the month. Happy 2026, everybody. We are back online. Yes, happy 2026, everybody. We are back. Last time I was with you all, it was January 31st. Came on here to do a quick New Year's. How you doing? What's going on, everybody? Did that. But we're back. Back heavier than ever. Hopefully everybody had a happy, safe New Year's. I know people like to get out there acting a damn fool. I know you weren't one of them. So, yeah. Hopefully you had a great, wonderful New Year's. And we're going to kick off 2026 strong and prosperous and great and all those other good words. You know, I'm going to pick a few of them, fill it in. It's all means the same thing. Anyway, tonight though, it's January, and I thought about it. I said, man, you know what? I think I said it last week, a couple shows ago, I'm going to talk about some health insurance. I was looking for an expert, couldn't find one. I said, oh, well, I'm going to do some research on my damn own and figure it out and talk about it. So tonight we're going to talk about health insurance, open enrollment. As you know, if you haven't heard, premiums have gone up for quite a few people. It's unfortunate. We'll get into how I feel about healthcare and why it costs what it costs. But yes, we're going to talk about open enrollment in different states and different places. Anyway, but usually most people, you pick your coverage in January, November, December. Coverage kicked off the 1st. You also have till the 15th to the 1st. So last day deadline is January 15th, most places, and then from there you have till the 1st to sign up for your coverage. You don't sign up for your coverage by then, you're not getting none. So that's what we're going to get into tonight. Opening healthcare. So yes, open enrollment started November 1st, 2025 to renew, change, or enroll a plan. And it runs through December 15th. And the coverage kicks in on February 1st, Megan. The last way to enroll change plans for coverage starting January 1, 2026. January 15, 2026, final deadline to enroll, make changes for coverage in 2026. So if you need to change anything, do anything, all that, you got till the 15th. 10 days, ladies and gentlemen, 10 days to make your health coverage changes. Now, check personally with your health coverage provider, your employer, or whatnot. Now, this is just the overall date. The 15th is next Thursday. January 15th. Not this Thursday. That is the 8th. Next Thursday is January 15th. So, double check with your employer, whoever your coverage is, to make sure that is the case. Hopefully, you made any of the changes that you needed to make. Don't want you paying extra money that you need to pay, or being undercovered and having to pay more than what you would if you had the coverage. So you want to be right there in the sweet spot, So yes, November 1st, long gone, long before Thanksgiving, long gone. December 15th. January 1st was the last day, when coverage started. January 15th, last day to make changes, and then that coverage will kick in. February 1st. So if you roll between December 16th, January 15th, February coverage will kick in February 1st. Check with your employer. Some states that run their own marketplace have different deadlines. California, New Jersey, New York, Rhode Island, Washington, D.C. Enrollment extended through January 31st. Massachusetts, January 23rd, 2026. Virginia, January 30th. Idaho, damn, December 15th. Let me look. Wait a minute. Let me look at Idaho. Idaho don't play with you. Let's see. Idaho In most states, open enrollment begins January 15th. Idaho, December 15th. Damn, they don't play with you. They said no. We're not playing them games. We're not playing them games. Idaho ain't playing with you. December 15th. So you had to have it done. Now Idaho only got about what? Shoot, I don't know. A couple million people. I'm sure there's a couple million people in Idaho. I don't know how many people are in Idaho. But damn, coverage starts December 15th. Oh, let me look that up. Let's fact check this, ladies and gentlemen. I want to know for myself. Let's fact check. Does Idaho coverage stop December 15th? December 15th, Idaho would be a festive cold weather. No. Idaho, December 15th. Health coverage. Let's see. Let's look at this. Because Idaho, December 15th, that's not a game. For Idaho health coverage in 2026, December 15, 25 was the crucial deadline on the state's marketplace. Your Health Idaho, YHI, Your Health Idaho org to Your Health Idaho org to enroll for coverage starting January 1st, as Idaho has early open enrollment window, generally running between mid-October, mid-December. So they start like 2 weeks early than everybody else. Everybody else starts November 1st. They start mid-October. If you miss this deadline for 2026, you'll need a qualifying life event like losing other coverage, marriage, or having a baby to use special enrollment period for coverage sooner than the next open enrollment period. That's crazy. You only got a small window to get health insurance. You can't get health insurance whenever the hell you want it. Unless now, I know when you get a job, you get retroactive. And you can just start whatever, when you get you hired. But damn, you only get November, 2 months, 2 months, 2 months out of 12 to get your stuff straight. November 1st through what is it? Yeah, basically January 15th. So yeah, maybe 2.5 months. 2.5 months to get your insurance together, or you're not gonna have any. And Lord knows you don't want to be out there without any. It's not cheap. It is not cheap. So, quick. States that run their own marketplaces: California, New Jersey, New York, Rhode Island, Washington D.C. Extended through January 31st. Massachusetts. I used to say it totally. Massachusetts. I used to say Massachusetts with the T. It's CHU. Massachusetts, January 23rd, 2026. Virginia, January 30th. Idaho, December 15th. Damn, you're in Idaho. You've been out of luck. Dang. 31st. Okay, now, that being said, that's an enrollment period to get your stuff. Now, one thing I didn't really understand how to read a healthcare plan. They are kind of confusing. Because, what's a premium? And what do I get and what don't I get? Because, they have the health coverage with the lowest payment. Oh, it's trash. But if something happens, your premium, your deductible is stupid high, like $5,600. It's something that you don't want to pay. So you have to go find middle of the road. But I realized, let me not get the cheapest thing because the deductible is so high. And if you really need it, there it is. And then it barely had anything on it. The guy was like, oh, if you're healthy, your age, you should want to get something like this. I'm like, nah, man, I'm making decent money. I want some good health insurance. Because I don't know about most people. You're on your parents' health insurance until you're 26 years old. At least I was. I don't know if the law has changed since then, but most people can be on their parents' health insurance until you're 26 years old. If you can, you better take advantage of that, which is a pretty long time. 26? Yeah, that's not bad. That's not bad. It's a pretty long time. Let's see. What is open enrollment? Time to buy a new plan, update your existing plan, apply for credits, financial help, whatever. Basically, it's time to say, well, do I need to make any updates? Have I had, some things going on healthcare wise, and I need to get some better current coverage because I'm paying too much? Or, do you need to increase your plan and get better coverage? Or maybe if you're, a younger person or whatnot, decrease your plan so you can save some money. I don't think you should do that. I think you should just have some decent, You get the middle of the road. Maybe not the most expensive thing, but get the middle of the road. The cheapest thing, you don't want that. You don't want that. You don't want the cheapest healthcare you can get out there. Let me see. Let's go through some states. Now, I want to get through some premiums. I want to talk a couple people. Here's the for a 40-year-old. Okay, this is cool. So let's look at the healthcare premiums in some states. I was curious about that. I don't know. The deadline varied by state. Apparently, job. Yes. Yep. All different states, jobs. Yeah, it's not like this one set deadline. Cause I don't remember when our open enrollment period was. Sure it's passed. But yeah, your job might have a different open enrollment period. States, because it seems like all healthcare state ran. It seems like everybody has their own state marketplace. You go through the state and you deal with them and get their healthcare through them. And now they're the same companies. They still have like Blue Cross, Blue Shield, what's their name? Monrovia? Molina, Blue Cross, Blue Shield, is it Aetna, Humana, those companies. So, you still get it from those people. You're just getting in a different marketplace. But when you get your job, we have a job. A lot of your jobs, they got the same people, but they're subsidizing it because they're paying. Your employer is paying a portion of your health care. You're not footing the whole bill. But when you pay, we don't work, we don't have a job, or you're paying out of pocket, you're footing the whole bill. And we're going to take a look at what some of these premiums look like. Now, this is not an exact number. I'm not going to go to everybody's marketplace and look for all that stuff. I would, but not tonight. I'm not going to do all that. Not tonight. But I will. Another point in time. Where the hell is this? That's not it. Hold on. There we go. But I'm not there. Oh, man. Oh, well. You can still hear me, though. We're good. So, here we go. Concrete state level examples. Benchmark silver plans. Here's an illustrative premium changes before tax credits for a 40-year-old from Money Geeks analysis for 2025. So, these are just some estimate numbers. These aren't really, you got to estimates. All right. State, Arkansas, 2020. Whoa. I need a calculator for this. I need a calculator for this. We need to get these numbers in real time. Where's the damn calculator? Here we go. Okay, here we go. Calculator. Zoom out. Nope. There we go. Wait a minute. Wait a damn minute. Why can't I scroll? Okay. Calculator. Bam. We're in business. That's what I wanted. All right. Here we go. Where am I? Here we go. Here we got our premiums. Arkansas, $494, 2025, $823 premium, 2026 premium. So how much is that? $823 minus $494. How much is that? Big difference. That's $329 a month that a person will have to pay a difference. That's a lot of money. That's quite a big jump. 66%. Yeah, that's quite a big jump. I want to see it in dollars. Percentage is great, but I like to see it in dollars. Real time dollars. New Mexico 608 to 917. So let's see. Let's look at that. 917 minus 608 equals 309. $300. So I'm guessing $150 per paycheck because it's a month. So you're gonna have to come up with an extra $150 per pay period for that. Tennessee 566, 770, 38%. Mississippi 541 to 743. Texas, 586, 787. Let's see, how much is that? 787 minus 586. 201. That's still a jump. That's still steep. Alaska, wait a minute. Whoa. Alaska's 1,070. And it's going to 1,040. $30. 2020. Okay, so theirs actually went down. Alaska, but that's already that's crazy high. $1,000. That's insane. Look at this. $1,000 Alaska. That's wild. That's a lot of money. And who cares it went down 2%? You're still paying what? 30, 40% higher than everybody else. Well over that. Oh man. That's a lot. That's a lot. Well, that's how much the subsidies are running right about now. And yeah, because I don't know if you've been paying attention to the news. A lot of people are complaining about their healthcare premiums going up. You're not getting any better service. You're not getting any better care. They're just raising the prices because they can. And I always talk about this on this channel. Healthcare. The problem with healthcare in America, it's traded. It is a commodity. They're always going to put they're always going to put the shareholders above the patients. The people, they're going to, look, they're trying to make as much money as they can. So if they can cut costs and give you worse care to make more money, they're going to do it. They're doing it. They're doing it. You see, there's a ton of videos out there. I think there's a guy, he needed a lung transplant, and he just made a video. He was talking about how he was going to get the lung transplant, but then they called and the insurance company decided not to pay for it. Then he got put on the wait list. He ended up dying. Because the insurance would not pay for it. They wouldn't pay for it. And look, if you're cutting into the bottom line, they're not going to find themselves profitable. You're not getting it. That's what this is. This is a for-profit business. Insurance is for profit. In 2025, many people paid very low premiums after subsidies, including some plans that were $0 to low cost for eligible enrollees to receiving enhanced premium tax credits. Without enhanced subsidies in 2026, if enhanced premium tax credits expire at the end of 2025, as current law stands, average annual premiums could more than double from $880 a year in 2025 to $1,906 in 2026 for an ACA plan. That's 114% increase. For certain income brackets, a 45-year-old earning $25,000 could see annual premiums rise around $160 in 2025 to about $1,077 in 2026, roughly 573% increase without enhanced credits. Crazy high. And that's what? $1,000? That's half of his income. If the man's making $25,000 and it's $1,077, hell, off the top without adding 77 up, that's $12,000 a year. For to have it for a whole year, he's paying half of his salary, his money, what he makes in healthcare costs. Insane. Insane. You know, crazy thing about health insurance is you don't know how much it is until you need it. That's the problem. That's the problem with health insurance. You can't call down there, hey, how much is, I got a jammed finger, how much is that going to cost me? My toe, I stubbed my toe, I got a cut, how much is that going to cost me? You don't know. And then the insurance company, they're supposed to pay a portion of it, and you pay the rest. But, man, sometimes you get a big old bill. You don't know what they're paying for. And then you got to fight it. I got a bill the other day for some crap. I got to go take it and deal with that stuff. But anyway, open enrollment, healthcare costs, premiums, that's what we're talking about tonight. Now, I know a lot of people, speaking for myself, I've had situations where I didn't have health insurance and I had to go to urgent care and pay out of pocket. Nah, it's not cheap. I didn't have a choice, but it's not cheap. It's not cheap. I had to go to urgent care, pay out of pocket. Cost me what? It was my hand. my hand got infected, and there was this big old hole in it, and I ended up going. Well, he didn't do much for me. He just told me what to do. I had this big water bubble in my hand. I had to drain it. Oh man, it was wild. It was a lot. It was a lot that I had to do. But yeah, urgent care, good old urgent care, and it's cash. It was like, I want to say I paid like $400. Oh yeah, they stick it to you, and I had no idea how much it would cost me until then. I'm glad I had the money to pay, or otherwise we had a problem. But a lot of times you go to the doctor's office nowadays, they try to put you on some payment plan. They try to, oh well, we have credit. If you need to pay for this later down the road, you can pay for it here. No, I got insurance. Am I paying all that? No, how? But yeah, they got these payment plans for you. Want you to spend all this money? No, I'm not doing that. I'm not doing none of that. None of it. All right. I would like to go to one of somebody's health insurance, but I'm not gonna do that. But here's the thing: health insurance, when it comes down to it, you gotta do as much preventive maintenance as you can. Drinking water, eating vegetables, fruit, stuff like that. The stuff you're supposed to do. The not so sexy stuff. Drinking water, eating pineapple, salad. The not sexy stuff. But it's good for you. It's good for you. And if you do have insurance, use it. Go to the doctor, get yourself checked out, make sure you're good. Get your physical and all that stuff. Get all that stuff done. You need it. It's important. Get all that stuff done while you can. I remember I lost a job years back, and first thing I did, I lost it the beginning of the month. So what I did was, they still covered me for the rest of the month. I went and went to the doctor and make sure everything was good, because I knew my insurance was running out. I knew I was gonna get my next job. So I went to the doctor, make sure everything was good. I was good to go. Worked out. It worked out. But drop a comment below. Have you had any issues with your health insurance? Are you happy with your health insurance? Do you feel like you're getting robbed, or do you have good health insurance? Drop a comment below. Let me know. Want to hear from you. I'm gonna go to break real quick. We'll be right back. Life easier for you in 2026 with your health insurance. Now, I personally have had to pay out of pocket before. I didn't have a job. I did get in the marketplace and give me some health insurance. It wasn't the greatest by a long stretch. However, it was so expensive. It was like $500 a month. Like, man, this is a big chunk. I was so happy when I got a job. I didn't have to pay that no more. But I kept it for, I think I kept it for like 5 months, and then I let it go and I stopped paying it. I'm like, man, I can't afford this. This is too expensive. But yeah, it was a whole shindig. All right, health insurance. What are the top health insurance company? Companies. What are the top health insurance companies? So United Health Group, United Care. You already know what happened with that last year. Elevance Health, one of the biggest insurers with broad national coverage. CVS Health, Aetna, major national insurance under CVS umbrella, offering employer and individual plans. Centene Corporation, large insurer in government-sponsored plans. Medicaid, Blue Cross and Blue Shield state plans. Several independent Blue Cross and Blue Shield affiliates rank among the biggest insurers nationally. Guidewell, Florida Blue, major insurer based in Florida with large enrollment. Humana, large health insurance with strong Medicare Advantage offerings. So those are your insurance companies. There's only a few. There's only a few to go around. But I do know your employer is subsidizing a portion of your health insurance. So it helps save you some money. And that's what we always trying to do, save some money. We're all trying to save a little bit of money. I wonder if some states, if it's worth it to pay the tax penalty on their paper. Oh, right. Yes, I forgot all about that. Thank you for the reminder. If you do not have health insurance, you do have to pay a tax penalty. I think it's $500. I think it is. Let me check that out. No health. No health insurance. No health insurance. Wait. What was that? Oh, I lost my train of thought. Anyway, we're talking health insurance. We're talking open enrollment. Oh yes, paying out of pocket. Right. So yeah, I was paying out of pocket. 5 months until May, it was costing me like $482. It was up there, and I'm like, I don't need to go to the doctor no time soon. And I'm just paying $482, which is a significant part of my income. So I individually let it go, cause it costs so much money, and this is single by myself. I can imagine how much it costs with kids on their health insurance. Now I look, I don't have them at the moment, but I glance over and look at the cost for the kids. Like, damn, that's a lot of money. Definitely got to pay a lot more when you have kids on your health insurance, or just everybody, family, whoever you got on it, gonna cost you some more monthly premiums, all that good stuff. But you gotta have it. You gotta pay it. But I just couldn't afford it. I'm like, nah, man. Now I ended up finding a job maybe a couple weeks later. But I'm like, I can't pay this. This is stupid high. And I couldn't pay it. So I ended up not paying it. Let's see. So the top, where are they at? Health insurance companies. United Health Group, I've had them before, and I've had Blue Cross and Blue Shield. Guidewell, never had that. Florida Blue, major insurer based in Florida with large enrollment. Several independent Blue Cross and Blue Shield. Oh, Humana. So yep, those are Centipede, CVS Health, Aetna, Healthcare Services Corporation, Cigna Health, Kaiser Permanente. Those places are all yeah. All right, there we go. So health insurance. Now I do know, what's this plan? They got a different plan. It's like a healthcare savings plan where you just put money in, some money comes out your check, goes into an account, and when you need it, you use it without your insurance. I forgot the name of that plan. I never did it. I'm like, I don't need that. I'm not using it, so I didn't use it. But there is a plan out there where they take a portion of your check, they put it in this account. I just can't think of the name of it right now. But you put it in an account, when you need it, you use it. But I was told that you don't get your money back at the end, which is, oh no, that's not going to work for me. Hell no, I got to get my money back. That's not going to work for me at all. All right, here we go. Where's my this? Group insurance. Can a family get group insurance? Hold on, can they? Group. Let me see something about group insurance. Make sure I'm right. A family can't get group health insurance, but through an employer, most common. If a parent spouse works through an employer, they can offer health insurance. Small business, self-employed, family on payroll. Okay, yeah, you can't just get group insurance by yourself, but I know that's how they do it. As far as employers, they get group insurance to get this. Oh yeah. There we go. HSA, health savings account, flexible spending accounts. That is it. That is it. Thank you. HSA account. HSA account. Do you get HSA money back from me? Let me see if you get your money back from HSA. How true this is. Yes, it's yours to keep. Money in the health savings account is owned by you. Unused funds roll over every year. This is no use. Okay. That's not bad. I thought they took the money, but clearly they don't. But I never did it. I'm like, I don't need it. I'm not getting that. So I didn't get the HSA. I'm like, I don't need it. I got the insurance. So what am I pay for that? Why am I just have that money sitting there? I can put that money in my account on my own and draw some interest on it, right? But that's just me. That's just me trying to make a few extra dollars. Anyway, let's see what we got going tonight. Healthcare enrollment. Man, I hope we get to find somebody who works in the field and we can revisit this. I would love to revisit this because there's so many other things I would like to talk about and discuss as far as healthcare, health enrollment. Like this therapy, because a lot of people are talking about therapy is really popular now. Can you go get therapy with your insurance? Does it cover it? Right. Well, we cover it. One session. That's not gonna work. Well, then you need to take it down the street. That's probably what they're gonna tell you. That's probably what they're gonna tell you. So, yeah. All right, let's get into it. We're gonna get into the news. If you got any questions, you want to drop some health care related stuff, feel free. Drop it down there. But in the meantime, we're gonna get on to this news. America invaded Venezuela for the oil. They get down there for the oil. Oh, we're going down there trying to look for drugs. No, they weren't looking for no drugs. They were looking for that oil, 100%. And that's what they got. Speaking of which, Chevron Energy stocks soared after capture of Nicolas Maduro, but oil prices barely move. Chevron and energy stocks soared Monday morning, though oil prices barely budged after the U.S. captured Venezuelan dictator Nicolas Maduro, and President Trump said American companies would tap into the nation's richest oil reserves. Shares in Chevron, which is only major U.S. oil company currently operating in Venezuela, jumped 4.8%. ConocoPhillips and ExxonMobil, both which left Venezuela nearly 20 years ago when Maduro's associates, President Hugo Chavez, nationalized their assets, arose 5.3 and 2.4% respectively. So yeah, definitely with this whole, he went down there for the oil, so oil stock prices may or may not be going up. So it'd be worth doing your research and looking into and see if you should get one or not. Makes sense to me. Okay, what we got next? On the next story. Oh, this is funny. This is interesting. Let's see. Let me show y'all this one. This is interesting. How Kraft Heinz lost its edge in the mac and cheese aisle in the brand cooking up competition. Kraft mac and cheese was never great, but I'm just curious about it. Kraft Heinz has long been America's go-to when it comes to mac and cheese, but that dominance is starting to crack. The Chicago-based food giant has seen its grip on the category loosen as an upstart rival Goodness wins over shoppers with premium Chetty Mac offering. Chetty Mac? What? No damn Chetty Mac. I'm a grown person. I don't know damn Chetty Mac. In just 3 years, Kraft and mac and cheese market share has slid to about 39% from 45% in 2022, according to Saranka data cited by Wall Street Journal. Kraft mac and cheese is being squeezed in the middle to possess and conventional win premium shoppers, but too expensive to beat store brands on price. Well, I don't know what to say about that. She sound like she liked the mac and cheese. Okay. Mac and cheese. But yeah, mac and cheese, Kraft mac and cheese was never my thing. Never my thing. I don't know. I didn't even make mac and cheese for the holidays. I sure didn't. Because you got to use all that mac and cheese. Mac and, let me be honest with you. Let me get mac and cheese is, I like it. But I don't enjoy making it. It takes a lot of cheese. And everybody don't taste the same. And you got to buy good cheese. Good mac and cheese about what? I don't know, $10, $15 at most? Somewhere around there. You got to pay that. Hello, son. Hello? Mom, thank you for watching. Talking a little Kraft mac and cheese. And let's see. Do I got any deals for y'all? I'm trying to think. I gotta start going to find some deals. Let's see. Oh, real quick. If you haven't, I don't know if people still use it, but Groupon. I was on Groupon the other day. I'm like, man, I go in there for like massages and stuff like that because they're going to get a discount. Now, some places I just go one time. Every now and then I might like it. I'll go back. But let's not forget in 2026, look for the deal. Speaking of the deal, side note, let's talk about something else real quick. Hold on. Kraft mac and cheese went down on quality like other companies. Now there's no more competition. Yeah, there is no good box mac and cheese. Now there's restaurants that make great mac and cheese. You don't have to make it yourself. You can go somewhere and get it, and save yourself the time and the money of making mac and cheese. Like I said, I still like it, but I just think people make it better than me. I don't really care to make it. But if called upon, I can and will make it. But speaking of food, I was thinking about something very interesting. Talking about, I don't like going to restaurants where they don't have the price or a picture. Like, I'm just supposed to order and hope this works out for the best. I don't like those restaurants. Not a fan. However, you ever notice when you go get steak, they always have how much the steak is? 3 ounce, 4 ounce, 5 ounce steak, 12 ounce ribeye, whatever the case. They always have the ounces. Why not with fish and anything else? I would like to know how much I'm getting, because sometimes they don't give you enough. And I realize, when I get a steak, they always tell me 5 ounces, 8 ounces. You get the fish. Well, I gotta ask, how big is the fish? You got a picture on your phone? Let me see. I asked her, wait, you got a picture on your phone? Oh, no, I don't. Y'all should take a picture of everything so we can see what it is. Because I feel like when you go to restaurants, they try to play you with the fish. You don't know how much you're getting. I went to a restaurant a couple months back. They had the fish on this little bed of potatoes. It tastes great. Little piece of fish. I would have got something else. I saw somebody else got the chicken behind me, across from me. Whole chicken, roasted up, looking good. I said, man, she got that shit. But it happens. It happens. Okay, let's get back to this. Man, this guy Trump dominates the damn news. Everywhere you go. Everywhere you go. This guy is dominating it. Gold and silver, nope. Disney paid $10 million to resolve alleged violence child. Oh. Disney paying child abuse law. What's going on here? What Disney got going on? Let's see, y'all. Let's take a look. Be nosy. Disney. Oh, there we go. That's what I was looking for. Disney to pay $10 million to resolve alleged violations of child privacy laws, Justice Department says. Walt Disney Company has agreed to pay $10 million civil penalty as a part of a settlement to resolve allegations it violated child privacy laws, the Justice Department said on Tuesday. A federal court order in the case of involving Disney Worldwide Services Inc. and Disney Entertainment Operations also bars Disney from operating on YouTube in a manner that violates children's online privacy protection, department said. What did they do, actually? Come on. The order requires Disney to create a program that will ensure it properly complies with privacy law on YouTube in the future, it added. The law requires websites, apps, and other online services aimed at children under 13 to notify parents about what personal information they collect and obtain verified parental consent before collecting such information. Yeah, why y'all need kids' information? What y'all need that for? They're probably going to try to advertise them, and then they're going to be bugging the hell out of their parents. Parents going to get tired of you, and there you go, so forth and so on. You don't want to do that. You don't want to do that. So, there it is. There you go. Healthcare insurance. Health insurance, ladies and gentlemen. Check with your marketplace. If you don't have it, double check. Make sure it's everything that you need. If you had a life event, getting married, children, you can make a change. Other than that, you're stuck. So make sure you check into that. Check the deadlines in your state. If it's Idaho, you've been out of luck. But everybody else, you got to the 31st. So definitely take advantage of that. Make it happen. Make it happen. Make it happen. All right, ladies and gentlemen, I'm signing off for the night. I'm signing off. But we'll be back again Wednesday with more Cheap Not Broke, more Wednesday Rant, more everything. I appreciate you all tuning in and supporting me, supporting the channel. It's very much appreciated. And with that being said, we will see you all tomorrow night. No, Wednesday night. Get my nights confused. Wednesday night, Wednesday Rant. We'll see you. Take care.